Hi, and welcome to Call to Compassions, Boundaries and Ethics with Individuals Serve Training. Definition of boundary: a real or imaginary point beyond which a person or thing cannot go. Synonyms: border, end, margin, outside, limitation, cap, extent. Merriam-Webster, 2024. Boundaries are like your home. They encompass your mind, body, and soul. Would you let a strange person into your home? Would you barge into someone else's home? How to set boundaries. Setting boundaries has 3 topics to address: the boundary itself, the what, the when for the boundary, and the why for the boundary. Boundary, the what. I don't answer phone calls or texts. When? While driving. Why? Because I'm worried I will get pulled over or get into an accident. Note about human behavior. While we tend to forget the whats, the whys and whens behind the boundaries are harder to forget. Much like how fairy tales give us life lessons that we remember, even if we forget the specific fairy tale. Examples of the what, when, and why. While I'm at work, I can only respond to text messages. If you call me, I won't be able to pick up. We always take our shoes off at the door because then we don't have to sweep as much. When I'm asleep, only wake me up if there's an emergency. If I become upset, I will let you know that I need a break for 10 minutes. During that time, please let me have my thinking space. How to help the individual set boundaries. Helping the individuals we serve to set boundaries themselves. Help them identify what the problem is that is causing the upset. Help them identify the why or precursor events that lead up to the problem. Help them identify what to do instead. Help them turn it all into an I statement. How to help the individual set boundaries continued. Identifying the problem. Having a negative feeling, like anger or embarrassment, should trigger the realization that a boundary needs to be set. He is mad. She is anxious. Identifying the why behind the problem. Once the feeling is identified, the reason for the feeling can usually be identified. He is mad because my daughter ate all of his cereal. She is anxious because she gets scared of riding in the car with strangers. Identifying what to do instead. Help the individual think up 1 or 2 things they can do to be proactive in the situation, as opposed to staying upset and lashing out or shutting down. Let's label all of your food with your name so there's no confusion. Then we can let daughter know about the mishap with the cereal. Let's think of 3 questions we can ask the stranger so they feel less strange to us. Turn it all into an empowering I statement. Help the individual sum up what you just talked about, making sure to say I get mad when other people eat my food. I will label my food items with my name so this won't happen again. I become anxious when I ride in the car with strangers. I would like to get to know you better so I can feel better. What's your favorite movie? Here are some good rules to follow with boundaries. Let your yeses be yes and your nos be no, unless the circumstances change outside of your control. Set your boundaries and stick to them. Modifications to boundaries can be made, but make sure to explain the reasons for the changes. Include the benefits of having the boundary. Define how the boundary is important. Throwing away expired food is a good boundary to have because it keeps us from getting sick. Keep it short. The average attention span is between 8.25 seconds and 7 minutes for conversation. If you've been explaining yourself for about a minute without their contributing to the conversation, you've likely lost their attention. Keeping your statements to 30 seconds is a good rule of thumb. Individuals we serve are generally used to 2 things with boundaries. 1. Boundaries without explanations. You do it because I told you to. 2. Boundaries that change with the wind. Changing schedules, changing rules, people that make promises they cannot keep. Explaining why a boundary is important for them and you is essential, even if it seems obvious. Never assume that people will understand your reasoning, especially if you haven't explained your reasoning. Unspoken boundaries. Unspoken boundary. A boundary that is set by the individual that is either a common knowledge boundary or can easily be established through actions or body language. Example, personal space, using appropriate language, not asking for money, safe touch, etc. Sometimes a person's unspoken boundary is unusual and is only understood through experience. Example, entering an individual's room without asking, moving their laundry from the washer to the dryer for them, etc. Unspoken boundaries continued. So how do we know? Ask. If you cannot ask, make a comparison that gives them a sense of normalcy. You know, I had a grandma who hated it when people would move her laundry because she had special ways to do it. That kind of reminds me of this situation. Watch for angry, sad, frustrated, or disheartened body language or cues, crossing arms, huffing or sighing loudly, putting face in hands, etc. common professional boundaries. Personal stories. Keep your personal history, relationships, money situations, health history, etc. to yourself unless it can aid the individual in growth. Only tell the shortened version. I did when I was in that situation, and I learned from that experience. Their personal history. We have the privilege of knowing their personal histories, but that does not give us the right to bring it up. Let them talk about their histories when they are comfortable. Remember that there are a lot of people in their lives that are trying to get them to talk about their histories. Social workers, therapists, PSR workers, caseworkers, doctors, roommates, friends, etc. Common professional boundaries. Touching and personal space. Rule of thumb is 3 feet away for personal space, maybe more for some individuals. Try to let the individual touch you first before touching them. Always ask before touching. Can I give you a hug? Stick to safe touch zones. Check out the next slide for an example of safe touch zones. Here is a diagram of safe touch zones. Take a moment to look this over and pause the video if you need to. Touch sensitivities. While we can never know for sure unless we are told by the individual, safe touch is often confined to the lower arms and the hands. However, there are some people that simply don't like to be touched. They may have a sensory processing disorder, as is often seen with autism spectrum disorder, or have trauma associated with touch post-traumatic stress disorder. The individuals we serve tend to have a high rate of abuse in their histories, which indicates that it is safer to not touch them than to even touch their hands. Common professional boundaries. Continued. Rules. Outline the most essential rules for your home. Idea number 1. Write out a contract for you and the individual to sign. Idea number 2. Make a poster that states the rules. Rules can include: pick up after yourself, take care of your personal items, respect the personal space and items of others, keep common areas as clean or cleaner than you found them. To summarize, a boundary, whether spoken or unspoken, is a rule that establishes personal space and safety. We can help individuals understand boundaries by giving a simple explanation for the boundary, which makes it easier to remember. And we need to know and remember our professional boundaries so that we can better serve the individuals we work with and be safe. Now, let's move on to ethics. Definition of ethics. The principles of conduct governing an individual or a group. Synonyms: standards, morals, norms, values, etiquette, customs, beliefs, manners. Merriam-Webster, 2024. Code of ethics. A set of rules and principles designed to encourage ethical conduct among a group of professionals. Call to compassion values and ethics. At Call to Compassion, we strive to embody the ethical values of professionalism, servant leadership, development, teamwork, work ethic, integrity, and accountability. With our clients, respect of the person and their decisions is paramount to how effectively we serve them. The 7 Codes of Ethics in Healthcare. The 7 Codes of Ethics in Healthcare was established to allow for best practices among healthcare workers towards their individuals. By following this code universally, we can establish consistent models of care that guide our daily decisions. The 7 Codes of Ethics are non-maleficence, beneficence, health maximization, efficiency, respect for autonomy, justice, and proportionality. Code 1. Non-maleficence. Definition: do no harm. Reason for this code: people often make decisions based off of client wants vs needs, which means that the long-term consequences of actions can outweigh the immediate benefits. Example: a client wants more of their pain medications than are prescribed by the doctor. The long-term consequences of this are greater than the short-term relief they will feel. Think addiction, having less medications that they may need later, etc. What to do? Call a professional involved in the situation and ask for advice, i.e., call their doctor. Note: sometimes do no harm means making the choice that causes the least amount of harm overall. Always ask for assistance if you're not sure. Code 2. Beneficence. Definition: make decisions that benefit the individual. Reason for this code: the goal here is prevent harm. Code 1. While promoting growth and health. Code 2. The individuals we serve often need assistance with their personal growth and health. Example: encouraging the individual to eat healthy foods. What to do? Offer advice and assistance in the follow-through of said advice, but respect their decision if they choose not to participate. Code 3. Health maximization. Definition: the health of the population is also important to keep in mind. Reason for this code: the family unit the individual stays with, the friends they hang out with, the state of the work environment, etc. are all factors that should be considered for the individual's health and well-being. For example, when the client comes home from work, he or she seems depressed, moody, and anxious more often than not. What to do? Discuss with the individual and possibly their team how the job may be causing them undue stress and harm. Discuss possible routes to consider regarding the job X. Finding another job, transferring to a different branch, talking with their boss, etc. Code 4. Efficiency. Definition: being mindful of the resources available and how they can be used to their maximum benefits. Reason for this code: resources for health management and for people with disabilities is limited. So finding and utilizing these resources can help prevent strain on the professional and the agency. Example: public modes of transportation, public activities designed for people with disabilities, public grants for making your home wheelchair accessible, etc. What to do? Keep abreast of new programs that come available, including sharing them with the agency and other professionals so that we can use these programs for all of our individuals and homes. Code 5. Respect for autonomy. Definition: respecting the individual, which includes their personal needs, decisions, and opinions. Reason for this code: to help prevent the individuals we serve from being ignored, abused, or used as a means to an end. Example: the person we serve refuses to take their medication. What to do? Ask how you can help them in the situation. Example: perhaps they're confused about their meds. If you're unsure how to respond to the individual's decision, email or call the caseworker for assistance of how to proceed. Note: always report missed meds to the caseworker the moment you notice it happen. Code 6. Justice. Definition: providing consistent care despite the circumstances. Reason for code: people need to be treated with fairness, professionalism, and consistent standards despite how they are acting or what their disability is. Example: you are struggling to assist your individual because they are in a bad mood and treating you poorly. What to do? Kindly reinforce your personal boundaries. We only use kind words here. And do your best to provide the same level of care they receive on good days too. Code 7. Proportionality. Definition: making balanced decisions that weigh the overall benefits with the overall costs. Reason for code: to assist with making just decisions where everyone is considered in the decision-making process. Example: the individual wants Chinese food, whereas everyone else in the group wants Italian. The individual wants to save for a car instead of buying a needed winter jacket. What to do? Discuss the pros and cons both sides with the individual. If possible, find a medium. Example: we can pick up Chinese takeout for the individual on our way to the Italian restaurant. We can get a winter coat at a thrift store so the individual can put the rest of the money towards the savings for the car. How to show ethics. By recognizing that the individuals we serve have different life experiences that have shaped who they are, by respecting their choices, even if we don't agree with them, by working together with the individual to piece together a plan that works in their best interests, by courteously and consistently maintaining our boundaries that we have set for ourselves, by advocating for the individual's health and well-being according to their wishes, by keeping the client's information confidential, by keeping our focus on client empowerment. To summarize, ethics is a set of moral codes or principles that assist us with guiding our everyday decisions. Our personal set of ethics is different from someone else's. Having an agency-wide set of ethics ensures that we are all working towards the same goals. We show ethics by respecting choices, keeping personal boundaries, working for the benefit of the individual and the group as a whole, family, agency, etc., and by maintaining confidentiality. When in doubt about what to do, ask questions or comments. This concludes Call to Compassion's Boundaries and Ethics training. If you have any questions, please reach out to your assigned case manager. Don't forget to fill out your worksheet. Thank you, and have a great day.